role of the medical examiner's office is to determine the cause and the manner of death. The cause of death being the disease or injury that initiated this chain of events that ultimately led to the individual's death. There are entities in the public, be it law enforcement, be it our county attorney's office, medical centers, vital records that actually keep track of these manners and causes of death to better inform them as far as their needs in community intervention or legislation or law enforcement matters, things of that nature. Essentially the data that we compile helps them in their day-to-day and meeting their goals as well.
A big part of this report is also just kind of helping public awareness. We touched on motor vehicle accidents, a lot of people being unrestrained, also just the amount of drug deaths that are increasing throughout the years. Not surprising necessarily, but kind of disheartening to see, and hopefully we can raise more public awareness to kind of get those numbers lower and lower as the years progress.
I think the only thing that's surprising to me is just the number of unrestrained individuals that die in motor vehicle collisions. I think it's pretty common knowledge that seatbelt safety regulations and seatbelt safety campaigns, I think it's common knowledge to folks, but it's just surprising to me the number of people that, regardless of these campaigns, regardless of the information, are still driving unbuckled essentially. And it leads to a lot of unnecessary deaths, unfortunately. Approximately 42% of individuals that died in motor vehicle collisions throughout 2022 were unrestrained. How individuals die in motor vehicle collisions, obviously speed is a factor, distracted driving is a factor, but one of the main factors that we've seen throughout 2022 is the amount of impaired drivers that are actually on the road. The legal limit is 0.08. We've had a number of individuals that were between 0.12 to an excess of 0.40 at the time of the collision. The high concentration of the alcohol surprises me, but the fact that people are still driving under the influence, unfortunately, it's not surprising. It's something we see on a fairly regular basis. But the high concentration is kind of the outlier this particular year. I don't think in previous years we've seen blood alcohol concentrations as high as we've seen last year.
We started with a new category this year in our annual report, which was infant deaths. It's something that I kind of felt passionate about and wanted to include in our report, just kind of to raise awareness for unsafe sleep environments was the big category we looked at. I know unfortunately they do kind of talk about it and try to teach at hospital settings with new mothers, but it's something that we see that is still kind of an issue. So hopefully with working with public health and safety and other organizations, we can just raise more awareness. Unsafe sleep can encompass a number of things, such as blankets being in the crib, pillows, anything that kind of can obstruct an infant's sleep, either covering their nose or mouth or getting into a position that they can't turn themselves or push something away from their face, and ultimately results in death. We investigated 50% of deaths of infants were due to unsafe sleep environments. It increased by 32% from 2021 to 2022. A big part of our job is not only just the autopsy, it's also our scene investigation with doing interviews with the family, seeing where the person lived, if they left anything like a note, or just the circumstances surrounding the death. We include both of those to conclude our investigation and ultimately rule that it was a suicide versus an accident or something else. This year, our suicide has trended up, and we've increased 109% from 2017 and 30.6% from 2021. We've included a couple new topics such as veteran suicides and pediatric suicides, which is anyone under the age of 18. I think as a nation, we have all recognized that veterans have struggles with mental health and trying to solve that issue and give them better resources. And so our office really wanted to take a look into our veteran population, and we recognize that they have a higher level of suicide rate versus the non-veteran population. Based in this year, 2022, 29.3% of veteran deaths are due to suicide. Looking into pediatric suicides, in 2022, 75% of those pediatric suicides were due to firearm use. Unfortunately, that once we want to look into proper storage of firearms with children living in homes so they're not accessible to them. So basically with just raising awareness on this subject, such as firearm safety and proper storage, we're just trying to give people better tools to avoid these situations in the future. Since 2017, we've experienced a 1,400% increase in drug-related deaths. We run toxicology on our decedents who come in that we suspect may be related to drug use, and we have found that a majority of those drug deaths are attributed to fentanyl. It's still around and it's very potent, which is part of the problem because it only takes one pill, unfortunately, and it can cause death. Second most common drug that is associated with death is methamphetamine use. It's not always that it's an acute death. It also can be related to pre-existing natural causes, and that drug use exacerbates those natural causes, resulting in death.
Pinal County, according to some of the resources out there, is the fastest growing county in the state. So as our population increases, with that comes an increase in the death rate. So I imagine that as our population increases, we will start seeing a variety in the types of deaths that we're seeing on a day-to-day basis, which then would prompt additional categories.
I just hope that this report helps to raise awareness about current issues that we have. Hopefully in the future people will become more safety conscious about things such as wearing a seatbelt or making sure they have a safe sleep environment for their infant, or helping programs that help people either become sober or find a way to reintegrate themselves into the public after they complete rehab so they can integrate back into the public successfully.